Hi. Um, I'm really not feeling up to this, but I know a couple people had asked, and sometimes this is just easier method to get information out. I went to see my primary care doctor today about the pain that I was having that we were pretty darn sure was my gallbladder. The right side of my back is pretty much swollen and inflamed. You can't touch it, or usually I'm going to pass out. Um, CBC came back normal. Urinalysis came back normal. We didn't know what antibiotic particularly could have caused it, or if I had some kind of organ damage before we started antibiotics orally or now IV. And I knew this was a risk going in. I take a medication every day called Actigol. It basically helps keep your gallbladder. So she was very, very, very concerned. So I needed to get an ultrasound pretty quickly on my abdomen and to check my liver, my pancreas, my kidneys, my spleen, and my gallbladder. Seemed that in our town there was a shortage of radiology technicians who do the scans. And we were afraid that I would have to go to the ER, but luckily we didn't. She got me in. Appointment with her was at 11, and I was having the scan by 3 o'clock. So I hadn't eaten, and it was. I've had a lot of ultrasounds, and it was the most painful one I think I've ever had. Especially my back. It was taking everything I could to lay there and be poked. It was red while I waited in the office so they could call my doctor. We found out that I do not have gallstones. I do have some fatty deposits in my liver, which very well could be scar tissue, which could be very, very easily explainable by the fact that when I was very, very young, I was in a car accident and I lacerated my liver. So very well, it healed on its own. Didn't have surgery. It healed on its own, and that could be scar tissue. But it's something to keep in mind for later scans. So after that, the next logical move would be either to go to the ER, since I didn't have gallstones, and get them to do what is called a HIDA scan, a HIDA scan. It basically gives you a readout on how well your gallbladder and bile ducts are functioning. And I really, really, really am not a fan of the hospital. I have a low immune system, and let's just put it this way. If you have Lyme, people treat you like shit at hospitals. I love to be proved wrong, and I have on a few occasions. My PCP is a very good example of that, but people see you with a PICC line in, and then they're like, you have what? You don't have cancer? Anyways, I really wanted to avoid that at all costs. So, again, my PCP's office did some calling around, and they got me first available scan at the place that I did the ultrasound was the 22nd, which is literally 11 days. So they called the only other imaging place in town that does HIDA scans, and the earliest they can give me in is Tuesday, this coming Tuesday. I'm also on the cancellations list, but I can't eat after midnight, so Monday I'm going to try to go as long, not fasting, but I'm going to try to go at least until they open at 9, close at 5. The scan takes about 2 hours. So I'm going to try to wait till at least mid-afternoon before I eat on Monday, just in case they can get me in on a cancellation. But I'm going Tuesday at 9 a.m. for the HIDA scan, and we will find out if indeed it is my gallbladder that's not functioning, or is functioning, or what level it is working at this point. That's when it gets kind of nervous for me, because either if it's not working, it has to come out. Unlike gallstones, which you could theoretically take out with an endoscopy or maybe a laparoscopy. Getting a whole gallbladder out is a little hard, laparoscopy, but it can be done. It has been done, but so I guess my worrisome thing is, and I don't want to get ahead of myself, but what is the pain if nothing is wrong? So hopefully I will know more by Tuesday, but I wanted to let people know I'm still running a bit of a fever. Yes, I'm in a lot of pain. My pain medicine is not cutting it. It was a very, very long day. While Jack was out of town, my uncle went into the hospital. He had a blood vessel burst in the left temporal lobe of his brain, and very small. The amount of blood seems to be dissipated, but we went and visited him, which was nice to see, and I could relate to a lot of things he was going through. And I think when I lost my memory, it kind of prepared my mom in some way, because it's her twin brother, to deal with just how he is and how he's responding. Jackie went out of town to visit her grandfather. I don't know if she's going to talk about this or not, but he has Alzheimer's, and in some way I think, she says it was kind of like when I lost my memory, because after a while the questions start repeating. So I feel very honored that my experience of losing my memory has gone so far in helping others. Sadly, we were supposed to have a rehearsal today, and we missed it because Jackie didn't want to be an hour away, and I had the scan, which was scheduled for about right when she needed to be leaving. She didn't want to be an hour away, and I have to go immediately to the hospital because had we had gallstones, I would have went to consult a surgeon. I'm glad she stayed, though. I am and was still really, really freaked out about all this, because it could very much slow down the whole process of this. I'm trying to think of what else we did today. A whole lot. Oh, I need some advice. Michael, I'm calling you out. I'm calling you out of the computer. I know you have an iPhone, and as I've mentioned before, I'm very, 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 very curious and very excited about this model. I know that the new applications came out today. The App Store, as it was called. Yeah. What applications did you download? And what have you found to be the most useful? Have you even played with it? Are there any applications that are worth buying? I've read a lot of articles about it and about what people are buying. I was just curious about what you bought. I'm saying I'm a lot because I'm really having a hard time through the pain. What case did you get? And did you choose leather or a silicone case or something in between? Did you need one of the clear coat shields? Did you buy the Apple Care plan? I know this is a lot of questions, but I'm really curious as to, I mean, obviously you're very pleased, and I'm curious as to, you know, what part of the phone still remains so amazing after all this time. And Jackie has really big hands, and she was concerned, because we did go and play with one today, that she was going to have trouble with the typing. Michael, I do not know the size of your hands, but I'm sure they're very petite. But Jackie has big man hands, and I have little tiny boy hands. So she was wondering how quickly you can adjust to using the keypad. Just some questions. You can answer it however you want, whenever you want. I'm just curious what has worked best for you as far as the iPhone. There's still some CIA stuff going on that I can't talk about. I don't know that I want to. It's a little crazy right now. I think that's it. I just want to let you guys know that I'm okay. I'm not in the hospital. My gallbladder is fine for now, and I'll update you guys soon. Take care. Enjoy your weekend, and I'll see you next time.